So before I start, I'm going to hand hygiene. Okay, my patient is unconscious, but I will be still explaining the procedure to my patient. Hi, my name is Paula and I'll be your nurse for today. I'm just going to be providing you oral care. Okay, I will be closing the curtains for patient privacy, and I will be checking for any visible discomfort or pain the patient has since my patient is unconscious. No discomfort, which is good. The bed is already at my proper working height, so I'm going to leave it as such, okay? All right. So first things first, I'm going to be donning clean gloves. Right over here. Okay. Then I will be assessing my patient's gag reflex. I will be assessing my patient's gag reflex using the tongue depressor.
I'm just going to test for the patient's gag.
Okay. So the patient has an impaired gag reflex, so I would need to use the suction. This is the yonker. I'm just going to connect it to the suction catheter and make sure it works. All is good. All is well. Okay, now she's ready for the oral care. Now what I'm going to do is I'm going to get someone to help me to position the patient properly in the lateral position, okay? Hi, so I'm just going to be positioning the patient in the lateral position. So using the transfer cord, we're going to push the patient on this side, and I'm going to be flexing loosely and rolling it facing me in the lateral position. Just being able
Get one more.
and I will be applying other support pillows just like this underneath his leg. Okay, and I'm ensuring that the patient's head is on the lateral position, the proper lateral position. Okay, now I have prepared the 2 cups, oral solution, and water, and I have 6 2-fets for this. I'm going to be cleaning the patient's mouth within 4 quadrants. Okay. First things first, I'm going to put the waterproof pad or soaker pad just underneath my patient's head, just like so, and the basin underneath the chin to collect any flowing fluid from the mouth. All right, I'm going to reassess the patient's mouth for any sores, white films. Okay, so the patient has no sores, no white films, no bleeding, so that's good. We will start our oral care. Okay, with the oral solution, I'm going to dip in my 2-fet and squeeze out the excess fluid on the end of the cup. Okay, first I'm going to do the patient's upper left quadrant in a rotating motion, just like so. Okay, second 2-fet. I'm going to be cleaning the patient's lower left quadrant in a rotating motion once again, just like so. Same thing, upper right quadrant. Okay. Sorry. And lower left quadrant. Sorry, lower right quadrant. Okay. And last things last, I'm going to be cleaning my patient's tongue and the roof of my patient's mouth. Okay. Oh, good. Now I'm going to be suctioning off any remaining fluid. Turn it on. Suction off fluids. Okay. All good. So now I'm going to be cleaning my patient's face. So, alright. I'm going to be removing the basin, removing the waterproof pad. Alright, and I'm going to be asking for assistance to position my patient properly. Oh, I'll turn back. Patient's pillows. Down patient. And pretend there's a transfer board. I will just sorry. Thank you so much. Okay, make sure the patient is comfortable. And the rail is up. Yeah, the rail is up. Patient is protected. All is well. I'm going to remove my gloves. Okay. And hand hygiene. Thank you.